Massachusetts, my colleague from Pennsylvania. Before that, I noticed that our colleagues on the other side of the aisle aren't here tonight to defend this piece of legislation. It doesn't surprise me, given what's in the legislation, and given what we've heard over the last week. The senator from Massachusetts was explaining what it was we were trying to do when we passed the Affordable Care Act now years ago. And part of what we were trying to do is extend coverage to a lot of Americans that didn't have it. In Colorado, my state, that meant over 600,000 Coloradans who now have health insurance that didn't have it before the Affordable Care Act was passed. Another thing we were trying to do was say to insurance companies that it's not okay to have as your business practice taking month after month after month of premiums from people, and then when they call you on the phone and say, my kid was sick, my kid got struck by lightning, my kid had an accident, to then hold them on the phone as long as possible just as a way of denying their claim. Because most people in America are too busy trying to move their family ahead, trying to get by, to stay on the phone all day with an insurance company. And while we were at that, we said, it's not fair to deny people insurance in the richest country in the world because they have pre-existing conditions. It's not fair that it's a business plan in America to have lifetime caps on people in the richest country in the world who might hit those lifetime caps because they get cancer. It's not fair in America, the richest country in the world, that some seniors have to cut their medicines in half every month just to get through the month and to pay their bills. And these were some of the issues that we were trying to address when we passed the Affordable Care Act. And Mr. President, I'm from a western state like you. I was out all those months in Colorado, having town hall after town hall, not just in Democratic parts of the state, but in Republican parts of the state, trying to explain what it was we were trying to do, both to give people better coverage, more predictable coverage, less costly coverage, and also to try to do something to bring down health care costs in this country. We succeeded at some of those things. We didn't succeed at other of those things. It was a legitimate attempt at trying to deliver something for the American people that people all over the industrialized world don't have to live with. Only in this country do people have to make choices about feeding their family and taking care of their kids at the doctor. Only in this country do seniors have to make choices about cutting those pills in half. Only in this country do people have to make choices about paying their rent and taking care of their kids. It doesn't happen in the rest of the industrialized world. And before I hear it from the other side tonight, let me say our results are getting worse, not better. For populations across this country, longevity is actually shorter, not longer. This is a difficult, complex, but urgent question for our country. And that's what we were trying to do with the Affordable Care Act. Some of it succeeded and some of it didn't. I'll talk more about that in a minute. But for years, for 8 years, Republicans ran for election after election after election on Obamacare. Obamacare is socialism. Obamacare is a Bolshevik plot to take over the United States. Obamacare is destroying jobs just at a time when we were coming out of the worst recession since the Great Depression, and saw uneven job growth in this country, but undeniable job growth over the entire period of time. They were saying Obamacare was destroying the country, destroying our economy. The recession was at the end of the last administration. This administration saw the previous Obama administration saw the largest job increase that we've seen in this country since World War II. I know it's inconvenient to believe that or to say that, and I know that in corners of the internet where false news really does dominate, people don't believe it, but it's true. And I'm the first to say there are not enough good jobs, and I'm the first to say there are not enough high-paying jobs, but compared to the record that was inherited, it was a success. All while we had the Affordable Care Act being implemented. All while we were extending coverage to millions of people in America, many of them children that didn't have adequate coverage before we passed the Affordable Care Act. It's been called every name in the book, just like President Obama was called every name of the book. And they linked those two things, health care reform, the Affordable Care Act, and Obamacare. That became its name. And every single attack under the sun was levied on that. Why? Because people really believed that it was destroying the healthcare system? Maybe some people did. Because it was destroying American businesses? Maybe some people did. I suspect there was a much more simple reason, and that was to try to win elections. And by the way, while we're on the subject, no matter whether you support the Affordable Care Act, and I support some things about it, there are other parts of it that have been disappointing to me, whether you support the Affordable Care Act or whether you don't, I think it's fundamentally important for people to understand that the Affordable Care Act is not our health care system. It's part of our health care system. The regulations that it placed on insurance providers so that people with pre-existing conditions couldn't be denied insurance is part of our system. The fact that it tried to create accountable care organizations so people got better primary care so we would reduce the amount of hospital readmissions from something like 18 or 19% of wasted billions of dollars in this country down to 2 or 3%, that's health care. But there's a lot of health care that has nothing to do with Obamacare, or something to do with it, but wasn't the creation of Obamacare. There's Medicare. There's Medicaid, there's doctors, there's nurses, there's patients, there's drug companies. That's our healthcare system. And our healthcare system is a mess. It is a mess. And we tried to take some things and improve it. When we passed the Affordable Care Act, some of it worked, some of it didn't work. Some people would argue we went too far. Some people said we didn't go enough. But I can tell you this, I've been doing those town halls again in Colorado, and what I know is that people feel defeated, not by Obamacare, but by the American healthcare system. But by our healthcare system, which is less predictable, less affordable than many countries around the world. Now, President Trump knew this. He's a smart politician. I never thought he was going to win. Never thought he was going to win. On a campaign that, on so many dimensions, was out of step with conventional American political thought. And I was wrong. He won. I don't think he represents a traditional Republican view, and that may be one reason he won. In no sense do I think of Donald Trump as a conservative. I think of him as quite radical in his proposals. I think of him as a reactionary force on a political system that the American people, for whatever reason, some of them probably good reasons, was losing patience with. But you can't deny that the guy somehow, in the far reaches of Trump Tower, somehow had his finger on the pulse of what was going on in this country, in some parts of this country. I don't know if it's because he was a reality TV star or what it was, but one of those things was health care, and he understood the American people's dissatisfaction with our health care system, just as these 7 years and 8 years of Republican campaigns have understood it, and they said, and Majority Leader McConnell made it clear when we were passing the bill, you own it. You own it. He said in a book later that it was very important to him that they were able to that the American people were able to demarcate between the Democrats' responsibility for the health care system as it was and the Republicans' willingness to take no responsibility for it. Even though we had hundreds of hours of hearings lasting more than a year, and we had, they're not countless, but 100, more than 100, well over 100, Republican amendments that were made in committee and on the floor and incorporated in the legislation. In the end, not a single Republican voted for the bill. And maybe that was a principled reason, not just a political reason. Because maybe there are some people who have the view in the Republican Party that the federal government shouldn't have any increased involvement in their health care system. In fact, I've heard some people say the federal government should play no role in the health care system. But whatever the reason, not a single Republican voted for Obamacare, and then the rest of the history writes itself, which is that every premium increase in America, whether it was related to Obamacare or not, becomes part of Obamacare. Every drug that gets increased in price becomes Obamacare. Everybody who loses their insurance, that's Obamacare. When what's really happening is something far more complex than that. There are very legitimate critiques of Obamacare, but it is not the same thing as our entire health care system. And I think it's important to make that point, because whether we are considering the Republicans' proposed bill tonight or someone else's proposed bill tonight, we'd have to understand that it wasn't going to fix the whole problem all at once. And people in my state are deeply dissatisfied with our health care system. I say that as somebody who voted for the Affordable Care Act. I've said it before. People have tried to make a political issue out of it. They write ads about, look, Bennet said the health care system is not perfect. I'll go farther than that. It is a crying shame that people in this country have to spend their lives wrestling with insurance companies, to lay up awake wondering or not if their kid is going to be able to get primary care or dental care or cancer care if they get sick. That keeps families up every night in my state. Not so much the people that are on Medicare, but a lot of other people. So, candidate Trump saw this unease in the American people, this concern that the American people had with our health care system, which I share. And in his campaign, in his very populist campaign for president, he promised to provide, quote, such great health care at a tiny fraction of the cost. Those knuckleheads in Washington don't know what they're doing. I'm going to deliver you such great health care at a tiny fraction of the cost. That was his promise to the American people. That's what he said that he was going to deliver. He differentiated himself from other Republicans who were running by saying, I'll never cut Medicare. I'll never cut Medicaid. Those other Republicans say they will. I'm not going to do that. But I am going to supply better health care than you're getting now at a tiny fraction of the cost. He said, quote, everybody is going to be taken care of better than they're taken care of now. Everybody is going to be taken care of much better than they're taken care of now. No cuts to Medicare. No cuts to Medicaid. And so we had our election, and people voted for this nominee who made not just these promises, but many other promises about what he was going to do for our economy, based, I think, on largely a complete fiction about what's actually going on in our country, and for that matter, in the world, with respect to our economy. So he won. And he didn't just win. The Senate is Republican, and the House of Representatives is Republican. And now, after running elections for 8 years to get rid of that scourge on America, that stain on America, that legislation that's destroyed our economy and destroyed our healthcare system, they wrote a bill. Took them a long time, really, to get it through the House of Representatives, which was shocking because they had 8 years to figure out what was wrong with the current system and how to address the current system. And they tried it once, and they couldn't even bring it to a vote in the House. Could not even bring it to a vote. And then, understandably, the people that sent those Republicans in the House to office said, "What are you talking about? You said you were going to repeal Obamacare. You told us all these terrible things that Obamacare had done. Your first order of business was to repeal Obamacare. How dare you not have a vote?" I'm glad they said that, because people should keep their promises. I have believed for a long time that people want consistency out of their politicians, that they'll put up with inconsistency if you say to them, "The facts are different than I thought they were, and that's why I changed my view." But in these times of fake news, of the media having the challenges that they are, and the rest of things that ail our system, consistency is not something that a lot of politicians pay attention to, and I think they think that's because voters don't pay attention to it. But in this case, they did. They said, "You said you would repeal Obamacare." You didn't just say it once. You said it year after year after year after year. And then finally, they passed a bill in the House. Not a single Democrat voted for it. And we learned from that process, which took place before the Congressional Budget Office had even scored the bill. Imagine that. All these people that criticized the Affordable Care Act proponents for rushing the bill through, a bill that had, as I said, between I think it was closer to 200 Republican amendments adopted, a bill that had almost countless committee hearings in the Senate Finance Committee and the Senate Help Committee, a bill that consumed, Mr. President, 25 days of legislative process on this floor, a modern record in terms of time. In fact, we had all that process, and here's what Senator McConnell, I'll come back to this, here's what Senator McConnell said about that. After all that process, he said on this floor, I think, that Americans were, quote, "tired of giant bills negotiated in secret." Oh, that bill was negotiated completely in public, painfully in public. I used to come home and people in my town halls literally had copies of the bill. You remember the chant, "Read the bill, read the bill"? That's because everybody had the bill. Negotiated in secret, then jammed through on a party line vote in the middle of the night. Well, on the House side, it's important for people to understand they passed the bill without even getting a score from what's called the Congressional Budget Office. Congressional Budget Office, the head of that is appointed by Republicans when the Republicans are in the majority, not the Democrats. Did not even get a score. We had a score on the Affordable Care Act before we passed the bill. We had a score that every single American could see about what it would cost and what money it would spend, what money it would save, how many people would be added to the insurance rolls. We had that. They didn't even have the decency to do that in the House, and they should have, because guess what happened? When the score came out, it said 24 million people would lose their health insurance. 24 million people would lose their health insurance after a candidate for president said, "You're going to have such great health care at a tiny fraction of the price. Everybody is going to be taken care of much better than they're taken care of now." Unless you're one of those 24 million, and I would argue many of the rest as well. I'll come to that. So, Mr. President, they passed that bill. Terrible bill. I think that bill has the lowest approval rating among the American people of any piece of legislation that has existed in the time that I've been in the Senate. It's still not as low as the approval rating of this place, which used to be 9%. But it's low because people know it doesn't really address their health care problem. It's not a health care bill. And then the president found out what was in the Congressional Budget Office score, and he had some Republican senators over to the White House, and he said, I hope you won't pass a bill like that. That's a mean bill. That's not my description. That's President Trump's description of the House bill. That is a mean bill. A mean bill. He said, I want a bill with a little more love in it than that bill, is what he said out of the Senate. Well, he's got to be disappointed tonight because the Congressional Budget Office score came back and said that under the Senate version of the bill, the less mean bill, only 22 million people will lose their health insurance. And that far from having better insurance at a lower price, that half the country, literally half the country, is going to pay thousands more in out-of-pocket expenses because of what has become known as Trump care. There are three principal parts to the bill that has passed the Senate and the House. There are some differences, but I would say they are differences without distinction. They're immaterial differences. There are three major components to these so-called health care bills. The first is a massive tax cut for the wealthiest people in America. If you are making $200,000 or less in Colorado or any state in the country, you will not get a penny from this tax cut. Not a penny. But as my colleague from Pennsylvania said, if you are one of the top 400 taxpayers in America, 400 taxpayers in America, together you're going to get $33 billion in tax cuts. That's an average tax cut for each of those 400 million Americans of $82.5 million. $82.5 million. There is not a person in Colorado at any one of my town halls who has said to me, Michael, the key to doing a better job with our health care, the key to fixing Obamacare, I'm talking about the critics of Obamacare. There's not a one who has said, repeal those taxes on the top 1% of taxpayers in America, at a time when our income inequality hasn't been greater than 1928, at a time when we are collecting in revenue only 18% of our gross domestic product and we are spending 21%. Not a single person has stood up in a town hall meeting and said the key to success here is cutting those taxes. I should mention that $82.5 million is over a 10-year period, just to be clear. It's about $8.25 million a year. And as Senator Casey from Pennsylvania noted, that $33 billion adds up to be the equivalent of what it would cost to pay for the Medicaid of 772,000 people that live in just 4 states, the entire Medicaid population of 4 states. But what they would consume in health care to try to support themselves and their family is not $8.5 million a year. It's not $85 million over 10 years. It's on average $4,500 a year on health care. That's the first part of this bill. A massive tax cut that's not going to benefit anybody in my state who earns below $200,000. It's about $840 billion. And in the Senate bill, the cuts are even deeper than they were in the House bill. I wonder what the president would say about that. The House bill was mean. I'll bet you that he would say the Senate bill is cruel because it perpetuates those cuts. And I've heard the rhetoric from politicians in Washington about why it's so important to cut that Medicaid. They need to cut that Medicaid so they can pay for the tax cuts. For people that are so wealthy, most of them probably don't even need to mess around with insurance to pay for their health care or their doctors. Now they're going to have another $8.5 million a year. Now they're going to have another $85 million over 10 years if they want to spend it not on insurance, but on whatever else they want to spend. And so, on the one hand, they've had to find the money to pay for this tax cut. They found it from some of the poorest Americans there are. And how do they justify that? They justify it by painting a picture that says that there are Medicaid recipients all over America who are receiving Medicaid but not working. And therefore, we should cut the program, because if we cut the program, they'll know they have to get a job in order to buy health insurance. And they won't be on the federal Medicaid program. They say that go to work. And that's why we can cut this program. Keep people out of that hammock that they're lying in, instead of working for their health care. What an insult to the almost 50% of Medicaid beneficiaries in Colorado who are poor children. Mr. President, are they supposed to go to work, or can they go to school? And while we're at it, maybe we should think about giving them better schools so they can actually compete in this economy. But are we really going to take away their health care? Then there are a whole bunch of people who have spent down their life savings for the privilege of being in a nursing home paid for by Medicaid. There's not a town hall that I have where there aren't sons and daughters or grandsons and daughters of people that are in nursing homes paid for by Medicaid after they had to spend their whole life savings down to be there. What a terrible system. It is. That a family has to come near bankruptcy before we say we'll give you a helping hand. Terrible system. But it's what they have. And they can't work. They're in a nursing home. They're in long-term care. Then there are a whole bunch of people in my state and other states, and this may be the greatest insult of all, who are working at one job or sometimes at two jobs, and who in the richest country in the world are working and are getting paid and are not getting paid enough to be off the Medicaid rolls. They are working and they still are on public assistance. And we're cutting a quarter of the Medicaid program because people need to go to work? I'm not making this stuff up. I asked Secretary Price. He's the Secretary of HHS. That's Health and Human Services. He's in charge of the health care for this administration. I said, Mr. Secretary, let me take you through the faces of the people in my state that are on Medicaid. And not only did he confirm that that's who's on Medicaid in my state, he said that's the way it looks all over the country. What an insult to justify a massive tax cut for the richest Americans by taking away poor people's health care by saying they're not working for it when they're children, when they're in nursing homes, when they're working one and sometimes two jobs in the richest country in the world. So that's the second part, Mr. President, of this health care plan. Tax cuts for wealthy people, cutting Medicaid for poor people, and in the middle of that is the only thing that could fairly be described as a health care plan. It's just a terrible plan. Senator Paul from Kentucky, one of the more principled people in this chamber, has said it very well when he called it, not politely, Obamacare light. He's absolutely right. If you hate Obamacare, you're really going to hate Obamacare light. It's the same structure, which amazes me because all the people that said we should repeal Obamacare now are preserving the very basic structure of how the program worked. But the problem with it is they've cut the subsidies. They've turned them into tax credits and cut the value of the subsidies. You think insurance is expensive now in the individual market? Wait till you meet Obamacare light, in the words of Rand Paul. So those are the three components of the bill, and it's not surprising to me that for those reasons, Senator McConnell has written this bill in secret. It's not surprising to me that he hasn't wanted to have a committee hearing. It's not surprising to me that he brought the bill here on the floor last Thursday, then accused people on the other side of not having read the bill, and still wants us to act on the bill this Thursday, so he can go home before July 4th and say to the American people, we did it, we did it, we kept our promise, we repealed Obamacare. We may have written a terrible piece of legislation that has nothing to do with improving your health care, but we repealed Obamacare. And he's hoping the American people won't notice. Let me tell you something. The American people are noticing. There's a reason why the House bill has the worst approval rating of any piece of legislation in modern American history. The American people are not stupid. I was in Frisco, Colorado, Mr. President, not that long ago, which is a place that everybody should visit from all over the country. There's tremendous skiing, and there's tremendous hiking, wonderful people. And before I had the town hall meeting, I went and visited a healthcare center there that they are justifiably proud of. It turns no one away. It gives phenomenal primary care. It gives phenomenal dental care. They have to figure out every week how to get through, but they always figure out how to get through so that people in Frisco and the surrounding area have health care. This is not a poor community by American standards. And I asked, it's a resort community, but there are people that live there all year round. Mr. President, I asked the people that run the clinic, well, who are the payers for health care in your clinic? Who are they? What pays for health care here? And she said, well, Michael, the Medicaid is 33%, which shocked me. Because if you're in rural Colorado, the Medicaid number is usually a lot higher than that because people don't have access to a lot of resources, and we all know they don't have access to a robust insurance market. 33% Medicaid. 53% was uncompensated care, and the rest was private insurance companies who paid for the insurance. And that shocked me. And I said, 53% is uncompensated care, people with no insurance. How can that be? And she said, these are people in our community who make too much money to be eligible for Medicaid. but they can't afford private insurance. They're working full-time, that's not the problem. They're not even, as I described before, in a case where somebody is paying them too little so they're eligible for Medicaid. Their problem is they're being paid too much and they're not eligible for Medicaid as a result, but they can't afford private insurance. That, I think, Mr. President, is an indictment of the Affordable Care Act that I accept as somebody who voted for it. The idea that we would require people in America to buy health insurance and then not have a market that gave them quality health insurance at an affordable price is ridiculous. And I've had people in rural Colorado say to me, Michael, look, why are you requiring me to buy something where there's not enough competition, so the premium is high, then the deductible is ridiculous, so it's of no use to my family, and you're requiring me to buy something that's useless to me. And we should have more competition to drive down price. And I say, you know what? You are 100% correct. And if we had a functioning Congress that wanted to take a bipartisan approach to fixing that problem, we could fix it. And there are probably 15 or 20 other things along those lines. But the Republican health care bill, so-called health care bill, does none of that. It does none of that. So to the extent that you don't like Obamacare because you feel like your premiums are going up and you're not getting enough for it, as opposed to the millions of people that have gotten insurance as a result of it, some of whom for the first time, to the extent that you're worried about that, this House bill makes it worse. The Senate bill makes it worse. There is a projection in the CBO report that says that at a certain point in time, your premiums might come down under the Republican bill, but the reason for that is because you will be buying lousy insurance. It's not because Donald Trump, as he said to the country, has provided such great health care at a tiny fraction of the cost. That's not the reason. It's because they provided terrible health care at a fraction of the cost. That's not a benefit to anybody. If an insurance company can put you on lifetime caps, of course they're going to charge you less. I am all for working together in a bipartisan way to address the issues in our health care system that frankly go far beyond the Affordable Care Act, to make sure that people in America don't have to continue to make the choices that people all over the world don't have to make, about having to stay in a job you hate because you have to keep the insurance, or being able to quit a job and do something else because you know the insurance will be there. Nobody else has to make those decisions, and nobody else in the world goes bankrupt because of health care. But that's still a problem in America. I think fundamentally the problem we have here tonight is that the proponents of this legislation didn't set out to fix our health care system. They set out to repeal Obamacare, or the cartoon of Obamacare that they've been running on for the last 8 years. That's what they set out to do. And along the way, they obscured it all so they could have the opportunity to cut taxes on the wealthiest Americans, which for some reason is an obsession with some people around here, and dramatically cut access to health care by poor children. I know there are people that are hearing this that won't believe it, that what I'm saying is true. It is true. And I hope that you will familiarize yourself with the facts. I hope in particular people that feel that the last bill that we considered on this floor didn't get the process that it was deserved. People who quite rightly wanted to make sure that members of the Senate and the House had actually read the bill. People who wanted to know what it was like to live in a country where your health insurance is uncertain from month to month. where you have to decide between paying the rent, buying the food, or being on health insurance. People who are dealing with and whose families are dealing with the effects of this terrible opioid crisis. There wasn't even really a gleam in our eye when we passed the Affordable Care Act. And I especially say to people living in rural America, how sorry I am that people aren't paying attention to your needs, that your hospitals may be cut because of an ill-considered piece of legislation that has nothing to do with delivering health care in rural Colorado or rural America. We can do so much better than this, but to get to a place, unfortunately, where Democrats and Republicans have the opportunity to work together, the first order of business has to be to defeat the bill that's on the floor. And I hope people know that this is the week when it's critical to call and let your voices heard, let people know you expect something better than what we're getting. And Americans ought to have a health care system that's affordable, that's predictable, and that actually creates stability instead of instability for their families. Mr. President, I yield the floor. And I suggest the absence of a quorum.
Clerk will call the roll.
Mr. Alexander.